modern society, facial aesthetic treatments are more than skin deep. They address a variety of concerns such as fine lines, wrinkle, and volume loss. Underlying causes are several factors contributing to this concern, which including aging, collagen and elastin production's decline, leading to reduced skin elasticity. Environmental influences, factors like sun exposure, pollution, and smoking can expedite skin aging. Consultations is important if you're considering facial aesthetic treatment. At Anahu Clinic, we embrace a holistic approach. Our skilled healthcare professionals utilize a thorough visual explanations and personal consultations to tailor a treatment plan that fits your unique facial anatomy. In our modern society, facial aesthetic treatments are more than skin deep. They address a variety of concerns such as fine lines, wrinkle, and volume loss. Underlying causes are several factors contributing to this concern, which including aging, collagen and elastin production's decline, leading to reduced skin elasticity. Environmental influences, factors like sun exposure, pollution, and smoking can expedite skin aging. Consultations is important if you're considering facial aesthetic treatment. At Anahu Clinic, we embrace a holistic approach. Our skilled healthcare professionals utilize a thorough visual explanations and personal consultations to tailor a treatment plan that fits your unique facial anatomy. Hi everyone! Welcome to Anahu Channel Live Sessions. I'm Dr. Anahu, founder and medical director of Anahu Clinic, an award-winning aesthetic and wellness clinic in Kuala Lumpur and Petaling Jaya, Malaysia. Today, we are diving into a fascinating topic, a new aesthetic code, function, regeneration, and transformations. Have you noticed changes in your face that make you feel less confident? Maybe things like fine lines and wrinkle, sagging skin, volume loss in the cheek or lips, dark circles under the eye, short chin. These are common concerns, but they don't just affect how you look, they also impact how you feel, your emotional part. If you have been looking for ways to enhance your natural beauty while still looking like yourself, this is session for you. So, misconception about aesthetic treatment. There are so many misconceptions about aesthetic. Some people think treatments are just about vanity or that they will make you look unnatural. Others believe it's only about chasing youth instead of focusing on health, confidence, and emotional well-being. So, What are we going to talk about today? In this sessions, we'll cover what functional, regenerative, and transformative aesthetic really means, how this principle restore balance to your face, and the most common treatment people ask about. And of course, we'll tackle some of your top questions like, do filler always make you look fake? Are injectables safe? Can non-surgical treatments really replace surgery? So stay tuned. I'll be here to debunk the myth and answer your questions one by one. So this is the Ask and Win segment. But first, let me introduce our Ask and Win segment. Got a questions about aesthetic? Don't be shy. Ask away during the live sessions, and you could win our complete essential kit. What's inside? NMN, which is good for energy and cellular health. Collagen Forte, which is good for skin glow and firmness. Plant Pro Plus, which is good for daily nutrition and gut support. 5 winners will be announced tomorrow on the Anna Hu channel Facebook page. So make sure you follow us and stay tuned. Why do our face age? So, why do we see changes like sagging or wrinkle as we get older? Isn't aging just natural? Yes, aging is natural, but the way our face ages depends on a few key factors. Loss of collagen and elastin. Skin becomes thinner and less elastic. Environmental stress. Sun exposure, pollution, smoking will speed up the process. Repeated expression. Smiling, frowning, squinting, baby cry, it will deepen lines over time. That's why we use the new aesthetic code, a modern approach to treatments that combine function, respecting your natural anatomy, regenerations, stimulating your body's own healing and collagen production, transformation, enhancing your natural beauty, not changing who you are. Now, let me ask you, would you consider trying aesthetic treatment to refresh your look? Type yes if you think treatment can be natural and confidence boosting. Type no if you are concerned. Maybe you have heard filler look fake or treatments unsafe. So don't worry, we'll clear up the doubts together. Before we go further, let's watch a quick video that explains facial aging and how functional, regenerative, and transformative aesthetic can help. In our modern society, facial aesthetic treatments are more than skin deep. They address a variety of concerns such as fine lines, wrinkle, and volume loss, bridging the gap between physical appearance and emotional expressions. Common facial concerns including fine lines and wrinkles, sagging skin, volume loss in the cheek and lips, dark circle under the eyes. Underlying causes are several factors contributing to this concern, which including aging, collagen and elastin productions decline, leading to reduced skin elasticity. Environmental influences, factors like sun exposure, pollutions, and smoking can expedite skin aging. Facial expressions, repeated use of facial muscle can cause dynamic wrinkles due to habitual expressions like frowning or smiling. To effectively address your aesthetic goals, we commence with a comprehensive consultations. At Anna Hu Clinic, we embrace a holistic approach. Our skilled healthcare professionals utilize a thorough visual explanations and personal consultations to tailor a treatment plan that fits your unique facial anatomy. What we just saw. Our face changes over time due to volume loss, sagging skin, fine lines and wrinkle. When everything is in balance, you look fresh and confident. But when balance is lost, you may start to look tired, sad, or older than you feel. That's where aesthetic treatment comes in, not to change your identity, but to restore harmony and bring out your natural beauty. Do fillers always make you look fake? not at all. When done correctly with technique like MD coats, filler enhance your natural features instead of distorting them. It's about balance, not excess. Are injectables safe? Yes, when performed by qualified professional. You may experience mild side effects like swelling or bruising, but these are temporary and manageable. Safety always comes first. Can non-surgical treatments replace surgery? For many patients, yes. Modern options like botulinum toxin A, for example, Botox, hyaluronic acid fillers, for example, Juvederm, enzymatic treatments, PB serum, and skin laser can provide natural lifting and rejuvenations without surgery. Of course, surgery is still recommended for more advanced cases if you start late. Have more questions? Drop them in the comment. You could win our complete essential kit. 5 winners will be announced tomorrow on the Anna Hu channel Facebook page. So make sure you follow us and stay tuned. Before we go further, let's watch a quick video. In our modern society, facial aesthetic treatments are more than skin deep. They address a variety of concerns such as fine lines, wrinkle, and volume loss, bridging the gap between physical appearance and emotional expressions. We offer a spectrum of tailored treatment, utilizing innovations practices like the MD codes for optimal results. Our treatments include topical treatments, anti-aging creams that enhance skin texture and stimulate collagen production, skin resurfacing technique. From microdermabrasions to laser treatments, we improve your skin visual appearance. Injectables, for example, botulinum toxin A, temporarily relaxes facial muscles, reducing the appearance of wrinkle. At the same time, we're also utilizing it to balance the emotional expressions of the face. Hyaluronic acid fillers restore volume and enhance contour using an emotional enhancement approach with the latest myomodulations effect. With proper placement of the hyaluronic acid fillers, to design whether is it on top of the muscle or below the muscle to give a muscle movement enhancement or muscle movement reduction. Thirdly, the enzymatic treatments. These including utilizing collagenase, lyase, and lipase for regenerations and skin restoration. This is extremely effective, especially to reduce the over-volumized face. For extensive changes, facelift procedure provide lifting and tightening for a youthful contour. So proper consultations will be required and assessment will be needed for surgical facelift procedure. Remember, your journey towards enhanced natural beauty starts with understanding and addressing your unique needs. Welcome back! Every face tells a unique story. So treatments should never be one size fits all. That's why we combine medical expertise with MD code, focusing not only on the technical sides of treatments, but also on how enhancement affect your emotions, expressions, and overall confidence. Here's a spectrum of treatments we provide. Number 1, topical treatments. Medical grade skincare such as anti-aging cream and serums that stimulate collagen, improve skin texture, and protect against premature aging. Number 2, skin resurfacing techniques. Options like microdermabrasions, energy-based devices, chemical peel that reduce pigment, refine pores, and refresh dull and uneven skin. Injectables, for example, botulinum toxin A, which relaxes overactive muscle to soften wrinkles while keeping expressions natural. Second, hyaluronic acid fillers, which restore lost volume in cheek, lips, chin, and under eyes, enhancing features while supporting emotional well-being. Enzymatic treatments like collagenase, lyase, and lipase regenerate tissues, remodel skin, and restore harmony by addressing fibrosis, excess fat, or poor skin quality. Surgical options like facelift procedure, for those seeking more dramatic and lasting transformation, surgical or minimally invasive facelift, sagging skin, redefine contour, and restore youthful structure while still looking natural, we will refer you to the right plastic surgeon. Q&A round 2. Is aesthetic treatment only about looking younger? Not at all. It's also about prevention, maintaining healthy skin, improving confidence, and correcting issues like scars, pigmentations, or uneven skin tone. Why should I go for aesthetic treatments if I already feel okay about my look? Because aesthetic is not only about appearance, it's about skin health. Treatment can improve hydration, elasticity, and overall wellness, even if aging isn't a concern yet. Is aesthetic treatment a luxury or part of self-care? Many people think it's a luxury, but it's actually a form of self-care and self-love. Just like going to the gym or visiting the dentist, aesthetic is about maintaining and prevention of aging. Okay. Okay, now let's look at the questions that we have today. Like now we have the first questions here from Madam Wong. Hi, Dr. Anna. Will face injections make me addicted? I think this is a very good question. It's also depending on what's the patient's desire. But most of the time, if we have a clear, distinctive idea of what we wanted to achieve, the moment when we achieve what we want, we should be able to conclude that particular treatment. So addiction is not a problem if we have a clear idea of what are the results that we want. However, addiction is a challenge, especially for those patients that come for aesthetic treatment, but the real root cause that they have or the things that challenging them, it's not the aging signs on their face, but is their inner insecurity, their anxiety, and their want in getting acknowledgements of people around them. If they do not get what they want, what will happen is they will be keep doing treatments. And sometimes I wouldn't think that it's addiction. Sometimes when the patients encounter challenges where after the aesthetic treatments or after plastic surgery, they might be so unfortunate that have maybe a botched job done and keep correcting the treatment to certain people is also considered as addictions as well. So another question that I have here is from Madam Wong again. Will I need to keep repeating the same treatments to maintain my look? So if usually what we normally will share with the patient is when they come for treatment, during the consultations and during the assessment time, what we will share with the patient is what are the ultimate results that we wanted to achieve. So for example, if a patient comes for pigmentation treatment, so during the treatment phase, we will be looking at what are their main challenge and identifying their root cause, at the same time to come out with a treatment plan. So during this treatment plan, our aim is to assist the patients in getting rid of the pigment. So the moment when we get rid of the pigment, then patients have choice to decide subsequently whether they wanted to maintain the skin conditions or to keep the skin healthy. So during this maintenance phase, the patients doesn't need to really perform as many treatment as what the patients need to do during the treatment phase. So during this maintenance phase, the results that they will get is constantly healthy skin conditions without pigmentations. However, There are patients that while during this maintenance phase, they were thinking that, hey, I want my skin to look even better. I would like my skin to have further or more glow. So during this particular situations, what we will do is we will propose some treatments options to help the patients to further improve on the skin conditions, to get the glow, to get the shine, to further reduce the pore signs or kind of thing. So it's purely depending on what's the patient's desire and what they wanted to achieve, and how's the patient's situations when they first come for treatment. So I have another questions here, okay, from Madam Wong as well. Why some artists look overdone? So this happened and it's very rampant nowadays. And over treatment, it's no longer uncommon because aesthetic treatments is available. In Malaysia, I would think that there are more and more aesthetic clinics that coming up, and most of the people are well versed with what treatments available in the market now. However, a proper treatment plan is extremely important rather than just keep correcting the aging sign. As what we can see from the social media, what happened is, for example, if the patients have looking for lip filler, and lip filler basically it will help to give several benefits. Number one, it will help to hydrate the lips. Number two, it will help to contour the lips. Number three, it will help to volumize the lips. And number four, it will harmonize the lips with the overall face. Overdone treatments, over-treated lips, it will appear when treatment is being done just for the sake of getting fillers injecting on the lips without a proper consultations of what the patient's desire, and without a proper assessment of how many fillers on the lips that the patients can hold, which will be able to harmonize with the face. So aesthetic treatment is not just about getting the treatment done. Aesthetic treatment, the most important part is getting to know the patients well and getting to know what the patients wanted to achieve and getting to know what the final results and how we can assist the patients to function better in their social circle rather than just getting the treatment done. Okay, then we go to the next questions. This is from Miss Gam. Will my wrinkle get worse if I stop Botox? Okay, it's a very interesting question. The answer can be yes and no. So before we dwell deeper into will the wrinkle getting deeper if I get after I get my Botox done, what is botulinum toxin A? Botox is only one of the brand representing medicines called botulinum toxin A. And botulinum toxin A itself, the main function is to reduce the muscle contractions. So again, it's like a sleeping pill. The dose of the botulinum toxin A will decide whether the muscle totally relax, partially relax, or just slightly relax. And there is two important functions for botulinum toxin A. Personally, I would grade it in a short-term benefit and a long-term benefit. So for the short-term benefit, when we inject the botulinum toxin A into the muscle, in about 5 to 7 days time, the muscle will relax. When the muscle relax, then the wrinkle will reduce because the muscle no longer contract as in before the treatments being performed. So how long will the relaxations last? It depends on, again, individual muscle strength. So if the patients come early, before the muscle is getting too big, generally the botulinum toxin A result will last pretty long. If the patients come later in life where the muscle strength is a bit bigger or the muscle bulk is big, then the patients might require more frequent treatments. However, we do not encourage patients to continuously non-stop injecting botulinum toxin A. The reason why is when the muscle stops contracting, the muscle eventually will reduce in size or it will get thinner. So if continuously botulinum toxin A treatment every 2 to 3 months once, before the wrinkles appear or when slight wrinkle appear, we go back for treatment again, what will happen? The muscle will get to thin, atrophy. When there is occurrence of thinning of muscle or atrophy happen, then the patients will have worsening of wrinkle due to volume lost. However, if the treatment is being planned carefully, for example, every 6 months once or every 7-8 months once with a good photo comparisons, botulinum toxin A able to assist an individual in anti-aging from the perspective of preventing the muscle from getting too big, at the same time prevent the wrinkle from getting too deep. So it's the same medicine, however, with proper planning, the patients will get only the benefit without the disadvantage. Okay? Then another questions that we have here is from Miss Maureen Lam. What is pico laser and how many sessions should I do? Again, pico laser is a type of laser which we aims to eliminate pigmentations. And the reason why we called it a pico laser because the laser beam itself, when it's being fired from the laser, it's carry a picosecond. And pico laser itself, most of the time are ND-YAG laser. For ND-YAG laser, the chromophore or the laser is targeting black or brown color pigment. So pico laser in common term, but usually we will refer to picosecond ND-YAG laser. So for picosecond ND-YAG laser, when we treat the patient's skin, our aim, which is the most important reason, we are using it to treat pigmentations. Melasma will benefit from pico laser. Solar lentigens will benefit from pico laser. Tattoo, hoary nevus will benefit from pico laser as well. So most of the time while we're performing the pico laser, because pico laser also come together with a Q switch mode as well. By adjusting of the different fluence, different spot size of the laser, at the same time with a different setting, what we can achieve not only pigmentation reductions, but we'll be able to achieve pigmentation reduction at the same time toning of the skin, make the skin firmer, tighter, and at the same time reductions of fine lines, especially the fine lines around the under eye area, the nasolabial fold, and at the same time the marionette lines. So in general, when we are talking about picosecond laser, we are talking about a treatment which will improve on pigmentations, allow the patients to get even tone, to get the glow, to reduce fine lines, and at the same time, it tightens the skin at the same time. Now, we have another questions here from Miss Chai Sin. If I start Botox from young, will my muscle become dependent on it? I also hope that my muscle will not be dependent on the medications. So first of all, we need to know why do we need to start toxin or botulinum toxin A or Botox. The reason why we wanted to start on Botox itself or botulinum toxin A is because number one, we would like to reduce the wrinkle. Number two, botulinum toxin A can also help to reduce the masseter to make the face become sharper and slimmer. And the third benefit of botulinum toxin A or Botox is it will be able to use for emotional adjustments. It's a very interesting tool which will be able to help in reductions of anger and reductions of sadness of our face. Then, how frequent should we perform botulinum toxin A? According to studies, botulinum toxin A will be able to last 4 to 6 months, depends on individual. For those who live a healthy lifestyle, generally they might extend the requirement of botulinum toxin A up to 7 to 8 months. So personally, I get my treatment done around 6 months once with two intentions, like what I've shared, short-term aim and long-term aim. My short-term aim is so that I'll be able to adjust my facial emotions, because for those who know me, most of the time people will say I look very fierce and I don't really smile a lot. So my face gives a very very stern type of features. So I use the botulinum toxin A in getting rid of my frustrations, especially on my frown line. As what you can see, I can't really frown very well now. Second thing is I also use the botulinum toxin A in elevations of my angle of the lips. The reason why is I would like to look more cheerful, especially to my loved one. So this allows me to communicate better. And my long-term aim for botulinum toxin A is so that I will be able to delay my speed of aging by reduce the size of the muscle to prevent it from getting too big or too thick to make us look aged, especially on the muscle bulk on the forehead, muscle bulk on the frown line, and also muscle bulk especially on the chin, where sometimes when the mentalist muscle contracting or become very active, it will also bring a sadness or angry face on our features. So in long term, I would like to eliminate and also to train my muscle to be calm and slightly more gentle. So now let's watch another short videos about preventions and maintenance tips to keep your skin or your face healthier. In our modern society, facial aesthetic treatments are more than skin deep. They address a variety of concerns such as fine lines, wrinkle, and volume loss. Before proceeding with treatment, always discuss any potential side effect with your healthcare provider. Common side effects of treatments may include swelling, bruising, and discomfort at injection site. What's the preventive measure to prevent early setting of the aging sign? The most important one are to maintain your youthful appearance and extend the longevity of aesthetic treatment, like sun protections, use sunscreen daily, and limit sun exposure. Besides that, healthy lifestyle choices like stay hydrated, eat a balanced diet rich in vitamins and antioxidants, avoid alcohol and smoking helps a lot. Customize skincare routine, tailor your skincare product to your skin type for optimal maintenance. It's important as well. Facial aesthetic treatment can provide significant visual enhancement and long-lasting benefit. Consistent skincare and follow-up will help maintain results and improve overall skin health. Consultations is important. If you're considering facial aesthetic treatment, it's essential to schedule a consultations with our experienced provider or your own aesthetic doctor who will craft a customized treatment plan to align with your goal. Questions to consider when you consult a healthcare provider. Number 1, what treatment options align best with my concern? Number 2, how will treatments interact with my current medications or skincare regime? Thirdly, what is the anticipated recovery time for my procedures? Fourth, what practices can I adopt to maintain my result after the treatment? Remember, your journey towards enhanced natural beauty starts with understanding and addressing your unique needs. Welcome back. Let's recap what we just saw. Preventions and maintenance tips. To make your treatment result last longer and to keep your skin healthier, wear sunscreen daily. Ultraviolet rays accelerate aging and pigmentations. So protect your skin every day, no matter rain or shine. Follow a personalized skincare routine. Choose the right product for your skin type. Ingredients like antioxidant, retinol, and peptides boost the treatment's results. Stay hydrated and eat a balanced diet. Nutrition fuel your skin repairs and regenerations. Avoid smoking and manage stress. Both accelerate collagen breakdown and inflammations. Stress management and a healthy lifestyle help your skin stay resilient. Have more questions about aesthetic? Drop them in the comment during these sessions. You could still win our complete essential kit. 5 winners will be announced tomorrow on the Anna Hu channel Facebook page. So make sure you follow us and stay tuned. At Anna Hu Clinic, our mission is simple: to help you age gracefully, feel confident, and look like the best versions of yourself. Okay, now let's go back to the questions again. So now I have questions from MWK. Can filler move around after injection? Again, for this question, the answer is yes and no. So on our face, right, we have 4 important structures. The deepest one is the bone. On top of the bone, it's the intertwine between the fat and also the muscle, including of the blood vessels and the nervous system, the nerve, and the outer surface is the skin. So when a doctor injecting fillers under the skin, the depth itself will determine whether the fillers will be movable or not. So if we place the fillers under the muscle on top of the bone, most of the time the fillers will not be able to move around. If we place the fillers on top of the muscles, every time when the muscles contracting, the fillers will gradually migrate to a lower pressure area. So if you do not want the fillers to move around, then the best placement, it will be under the muscles on top of the bone. However, when we go into slightly more detail, there will be occasions that we would like to place the fillers on top of the muscle with the aim that we would need to, or we want to reduce the muscle movement so that we can get a more harmonized type of facial features. And there will be occasions that we want the muscle to have stronger contraction. That will be the time where we will place the fillers underneath the muscle. So every time when we are talking about fillers injection, it's not purely about what fillers are you injecting and how many cc. The more important one is how we do the planning on the face so that we'll be able to give the patients the better facial expressions and to achieve what we wanted to achieve. I hope I answer your questions. Then come to the next questions from MWK. can I remove fillers if I don't like it? Again, the answer there is a yes and a no. You will realize that when we're talking about aesthetic medicines, there's always yes and no. So talking about can you remove the fillers if you don't like it? It depends on what type of fillers that you select and what are the intentions of the fillers injections. So just a tips. Every time before you perform the fillers injections, maybe you can discuss with your doctor in detail what type of fillers is being introduced to you. So for example, in our practice, the filler selections that we use, it's only hyaluronic acid. Why hyaluronic acid fillers? The reason why hyaluronic acid fillers is because there is a solvent for hyaluronic acid fillers. If you don't like it, or if the aesthetic sense that I have is different compared to yours, in the future, we can just dissolve it. However, there's another category of fillers which is not removable. So this group of fillers are called permanent fillers or semi-permanent fillers. So for permanent and semi-permanent fillers, we can inject underneath the skin. However, there is no solvent, there is no way for us to remove it. There's another disadvantage of this permanent or semi-permanent fillers is as we age, if there is a permanent foreign body underneath the skin, when our immune system drops, so sometimes the granulation tissues might happen. So with the permanent fillers inside too, and when our own immune system keep enveloping, covering the foreign body, eventually it will become a lump. So think first before you decide to use the permanent fillers to get a longer lasting results, because there is no such things as one treatment will serve us towards the end of our life. And there is also no treatments that is worth for us to risk our appearance, because if it's a semi-permanent fillers, if mistakes happen causing intravascular injury, there's no way we are able to reverse it. So discuss in proper with your healthcare practitioner or with your doctor before decide on what type of fillers that you are going to use. And if you are the type of people, the persons that you are not comfortable with changes or having a bit challenges in adaptations with your new look, go for the non-permanent fillers which have solvent before you proceed with the permanent filler. Okay, now we have another question here from Mr. Leong Ming Chen. So what are the common complications of injection? I would think that this is a follow-through questions when we are talking about fillers injections. So if the common complications of injections are, again, it's acute and also chronic, means immediate complications versus long-term complications. For immediate complications, injury usually they might cause a bit of swelling, they might have a bit of bruises, they might be having a bit of ecchymosis, like a big bruise type of injury, and that is most of the time pretty mild and eventually will recover with time. When we are talking about fillers injections, during these immediate situations, the other non-common or uncommon complications which have long-term implications on patients are, if there is intravascular injury, blindness is also on and off. We do see it from the news as well. When the fillers is being injected intravascular and the fillers is migrating and involve the eye blood vessels. So this is uncommon but happened. Secondly, the uncommon but happened on and off are intravascular injury, which leading to necrosis or dying of the skin. So this necrosis, it's happened when the blood vessels is being blocked. There is no supply of oxygens and food to the cell on the skin, where eventually it causes blistering and darkening of the skin, which required longer time to heal. So these are acute and immediate complications. Again, when we are looking at this type of situations, solvent for fillers is extremely important. So if we are able to identify earlier or immediately when the skin color changes or when the patients complain of visual loss, and we are able to take immediate actions by dissolving the fillers, most of the time is salvageable. However, if the selections of fillers are permanent fillers, then tragics will happen and patients might have to go through the full journey of recovery as in intravascular injury. So these are acute or immediate complications that might happen. So for long-term complications, when we're talking about long-term complications, granulation tissue, it might happen on and off. So sometimes after the fillers injections, patients might come back and then they touch on the skin. They will tell us that, doctor, I can feel that there is a lump there. So like what I have explained just now, when our immune system is attacking the foreign body on our face, if the selections of fillers, it's non-permanent fillers with solvent, so the solutions will be simple. We just need to dissolve the fillers and then eventually the swelling will disappear. However, if it's a permanent fillers with a granulation tissue, then surgical excisions might be one of the options. Besides, sometimes patients will come back with swelling on the face when there is infection. So one of the tips that I would share with the audience is, if you would like to perform fillers injections and immediately after the fillers injections, maybe 3 or 4 days later, suddenly you have a sore throat or you have gastrointestinal tract infections. So I would propose to see a healthcare practitioner or doctor and request for oral antibiotic or for an assessment. The reason why is the initial implantations of fillers underneath the skin is still haven't really integrated well with the surrounding tissues yet. So if we catch a cold or have bacterial infections or urinary tract infection or gastrointestinal tract infections, what it will happen is the circulating bacteria in the blood, it might lodge in the filler itself. So the treatment options will be simple. We just need an oral antibiotic to eliminate the bacteria, then the swelling eventually will reduce. If it's a permanent fillers, then the conditions will require longer lasting treatment time. So that will be more on the long-term complications of fillers and short-term complications of fillers. If you do have any questions, you can further type your questions down here. Then I have another questions here, which is from Madam Joanne Wong. Can fillers make my face look unnatural? Again, the answer is yes and no. It depends on the person who performed the fillers injections on you and how the treatment planning. So, patient always ask, how many fillers do I need for my face? So sometimes under experienced hand with a proper planning, the total number of fillers on the face, it might goes up to like 20 syringes. Yet the face still looks small and patients able to perform expressions well. If it's not planned properly, the patient may achieve the results that they want, which is eliminations of aging sign, for example, the nasolabial fold. But 100% eliminations of the nasolabial fold will make the patients look unnatural and heavy at the lower part of the face, despite only 2 syringes of fillers being utilized. So treatment planning is again very important in hyaluronic acid fillers injections on the face, and the depth of fillers placement is extremely important again, as what I have shared in the video where we are talking about the MD code and how do we assess the patient's facial expressions prior to fillers injection. Now, we can go to another questions here from Madam Rainy Nail. Do laser treatments make my skin more sensitive? Again, the answer is yes and no. If the patient's body is not ready for laser treatment, then the answer will be yes. So for the fact that the patients come to seek for help, especially on skin quality concern, looking at potential challenge like rashes on the face, pigmentations on the face, uneven tone on the face, before we proceed straight to laser, let's listen to the skin. What the skin is trying to tell us. For example, when the patients have pigmentations, that means that the skin have challenges in reduce the hyperactive pigment cell. So in our practice, what we normally do is we will do a proper assessment for the patients and to get to know their lifestyle better, to identify what could be the real cause that leading to darkening of the skin or hyperactive of the melanin. So the moment when we identified the cause, we wanted to know whether the pigmentation is it upscaling or already stabilized, or the pigmentations already downhill is gradually improving. So if the pigmentations is on the way getting worse, then laser might not be a treatment options for the patients, but we need to sort out the root cause first. So laser treatment is not a must for the immediate treatments of pigmentations treatment, but it can help the patient's skin to recover faster. So when we prepare the skin well, when the skin already have the capacity for recovery, then only we do laser. What the laser will do? The laser will fasten the recovery, and then the laser will be able to assist the patients getting better, tighter skin. Okay, then let's go to another questions from Madam Maureen Lam. For pigment skin, what I can do? So like what I have shared just now, for pigmentations on the skin, what I would propose, number one, to get to know what causes the pigmentation. Is it because of oversun exposure? Is it because of hormonal imbalance like melasma, or is it because of maybe due to liver challenges like horinivis? So getting to know the root cause of the pigmentations will be able to allow us to plan the treatment properly and then to get the results that we wanted. Then we can go to the next questions from Miss Chai Sin. Can Botox prevent wrinkle from forming in the first place? So as what I've shared just now, what Botox will do or botulinum toxin will do, botulinum toxin will be able to reduce the muscle activity. It allowed the muscle to rest, or it paralyzed the muscle so that muscle cannot contract. So in short, or immediate effect of the botulinum toxin A, what the botulinum toxin A can do is it will reduce the muscle activity, then eventually it will be able to assist us in reductions of wrinkle. So that is not a prevention, that is a treatment. However, when we continuously maintain botulinum toxin treatment every 4 to 6 months once, what this maneuver or this program or this treatment plan will do is it will prevent future wrinkle from surfacing, or it will prevent the muscle from getting too big. So it depends on what's our aim, whether and which are the phase of treatments that we are in. It can be at the treatment phase to treat the wrinkle, or it can be in the maintenance phase to prevent aging of the muscle and to prevent worsening of the wrinkle in the future. Then we can go to the next questions of Miss Carmen Yao. Does yellow laser helps to lighten pigment? Yes. Dual yellow light, it's one of the laser we use for pigmentations reductions. However, as a practitioner, there are many functions that what the yellow laser able to do. So one of the key function for yellow laser is to prevent new pigmentations from surfacing. Dual yellow laser or yellow laser able to assist in reductions of redness on the skin. So when the redness is reduced, the future darkening of the skin will reduce at the same time. So besides reductions of redness, dual yellow laser or yellow laser will be able to reduce the brown color pigmentations as well. It's especially effective for melasma treatment because dual yellow laser will be able to reduce the certain growth factor which surface during inflammations on the skin. Then we can go to the next questions. Miss Cinder Teo, after treatments of fillers and Botox, it may make my skin too moisture. This one, how should I answer these questions? Okay. When I talk about fillers, because in our clinic we only treat patients with hyaluronic acid fillers, so I would refer the fillers here as hyaluronic acid fillers. So fillers itself or hyaluronic acid fillers will be able to hydrate the skin. So the type of fillers we use in the clinic, they come in many different concentrations. It can be 15 milligram per ml, 17.5 milligram per ml, 12 milligram per ml, and of these different in concentrations allow us as a practitioner work as an artist to decide which other fillers are for which depth. So for the skin, we usually will use 12 milligram per ml of hyaluronic acid fillers. And for this context, it will be able to hydrate the skin. Will it make it too moist? The answer is no. It's only act for hydrations. The meaning of two here, I would think that sometimes when we are lacking of sleep, when our male hormone is dominant because the intake of sugar load is too high or too high carbohydrate load, or if we are taking our inflammations causing food, that will eventually trigger male hormone dominant, and that will increase the sebaceous gland activity to make the skin oily. Fillers itself, it only act as additional hydrations because hyaluronic acid able to attract more water compared to our connective tissues. Will Botox make the skin too moist? The answer is no. Botox, as in botulinum toxin A, and what the botulinum toxin A will be able to assist us on the skin quality maintenance, botulinum toxin A able to reduce the sebaceous gland activity. So when the sebaceous gland activity reduce, the oiliness of the skin will reduce. Then the pore size of the skin will reduce. The skin quality will appear more glowy and a bit more silky smooth. Okay, then maybe we can go to another questions here. From Madam Jacqueline, is it true that Botox will make my face frozen? Okay, this is also one of the commonest questions that patients ask. Botulinum toxin A, as what I have shared, one of the main function is to relax the muscle, or in medical terms, sometimes we say paralyze the muscle. This sounds a bit scary. So when we relax the muscle, for example, most of the doctor, they know how to plan for the dosage and also the depth of injections for the botulinum toxin A. So for example, if I wanted to make the muscle totally relax, I need to use the dosage, we will be able to relax the whole muscle. But sometimes my aim is not to paralyze or totally remove the muscle function. My aim is only to relax the muscle a little bit so that it's not so strong, yet the patient still able to function. So in this context, the dosage of the botulinum toxin A and the depth of injections of the botulinum toxin A will decide the ability for the muscle to contract. So the answer for, will botulinum toxin A make my face frozen? The answer will be yes if I overdose or overtreat. The answer will be no if I plan the treatment properly so that the patients will have reductions of movement yet able to express their emotion through their muscle movement on their face. Again, it's all going back to the treatment planning between the doctor and also the patient. Now let's go to the next questions here. From Shirin Ng, is it true that I can go under sun after laser treatment? So this is another question which the answer will be yes and no. So if my patient's undergone a fractional CO2 laser where there is significant resurfacing of the skin, I would suggest the patient do not go under the sun for the next coming 1 to 2 weeks. If the patients had had the treatments of, for example, long pulse alexandrite, and it's aiming for skin toning, and for this instance, when the patient asks me, can they go under the sun after the laser treatment? Unless except excessive sun exposure, like for example, go hiking, run marathon, go to the beach, I would say normal exposure is okay. So do not need to worry too much. And then when after finishing a laser treatment, you can get the better advice from your doctor or healthcare practitioner so that they can guide you well in post-treatment care so that you can get the best results from the treatment that you have done. Okay, so I would think that now it's almost time. So I would like to thank everyone for tuning in to our Facebook Live today. Your support keeps us inspired to share more medical knowledge and insight with you. So remember to follow and subscribe to Anna Hu channel for more updates on holistic health care tips. Your trust means everything, and see you in our next live sessions. For the rest of the questions that I haven't answered yet, don't worry, I will answer through the Facebook channel. With that, bye.